But while some churches still wonder how to deal with the current H1N1 pandemic, churches in Edmonton have declared war on H1N1 already. It's midday mass at St. Joseph's Basilica, and this church, like many others, has found ways to fight the H1N1 virus. They have drained the holy water from its vessels, placed bottles of hand sanitizer at every door.
This is the Lamb of God.
They have even gone as far as changing parts of one of the oldest portions of the service, showing that the Catholic Church in Edmonton, at least, is taking no chances.
We've added new protocols this past Sunday to all of our parishes, asking our parishioners to refrain from the sign of peace, which is our handshake before communion. As well, we've also been asking our parishioners to receive communion on the hand, and we've also discontinued receiving communion from the chalice, the precious blood.
And so far, Father Paul says their congregants have been okay with the change. But there is no thought yet as to when things will go back to normal. In fact, since H1N1 came on the scene, more and more people have been cautious about their daily interactions, while some feel all this talk about H1N1 has been overblown.
Yes, as a university student, I'm very worried about swine flu. I'm very cautious. I always wash my hands, wash my hands before eating or whatever I have to do.
I am actually. It's a pretty serious outbreak. I'm not letting it take over my life.
I think it's overblown. It's overhyped.
But while there still seems to be some confusion over H1N1 in the general public, one thing is for sure: this virus has wreaked havoc already. To date, there are almost 400,000 confirmed cases of the virus, and nearly 5,000 deaths have been reported, 80 of those from Canada alone. But as the world still waits to see if the virus will spread even more than it has already, the work done across the globe and in communities everywhere to prepare for a pandemic has everybody wondering not if, but when the big one will hit. There's no surprise that schools have been preparing their students as well. The Edmonton Catholic School Board has been working on a plan for the past 5 years.
When we had the onset of avian flu and also the realization that our world is overdue for a pandemic, we thought we better get a plan underway just to start with the process of how we would communicate to parents, because of course communication is invaluable.
Lori Nagy, Manager of Media and Community Relations Services for the Catholic Education Services.
Our key to our plan is really prevention, and so we have at all of our schools hand sanitizer stations. We also have posters. We are teaching children how to cover their cough and also make sure that they wash their hands. So right now we're really in a prevention mode.
With pamphlets and actual strategies in hand, teachers and principals like Lucille Charrois of Good Shepherd Elementary School have the job of making sure the plan actually works.
Well, at Good Shepherd School, we are working on prevention. Our key priority is health and safety of our students. So at the school level, we have set up 2 hand sanitizing stations for our guests and parents as they walk into the school. We have had hand washing demonstrations for all of our students and parents that are here at the time. At the classroom level, we are focusing on the education of having children wash their hands at least 5 times a day.
So what if there was a surge of H1N1 in their school? Principal Lucille Charrois says they're ready.
We hope that by washing our hands and covering our coughs that we will prevent a great sickness in our school. But yes, we are ready if that does happen.
Since the initial outbreak of H1N1 in Mexico, the virus has been on the radar for many major cities all across the globe. But what is H1N1, and should we be afraid? Dr. Voth, an internal specialist, says that while we have already hit pandemic status, the effects of the virus might not be as serious as once thought.
The best guess currently is that no more people will die of H1N1 than have been dying of the annual flu epidemic that we get every winter. The only difference is that it's expected that there will be a lot more cases.
And he would know. He has seen at least 2 cases of H1N1 already. And while the doctor feels it is imperative to keep yourself safe from the bug this season, the effects of this swine-avian flu hybrid might not have as big of a bite.
The H1N1 is not very virulent so far, meaning it doesn't make you very sick, possibly even slightly less sick than some of the other strains of flu we've had in the past. What sets it apart is that it has a very high attack rate, meaning it's very good at spreading, even in the summer months when flu normally doesn't spread very well. So we can expect that many more people in the winter will get flu than they have in the past. But they probably will be no sicker than they have been of the flu in the past, and the overall death rate in terms of numbers, if you have more people getting the flu, there will be more people who will die. But it probably proportionally will be no different than any other flu epidemics unless the virus changes as the epidemic carries on. That's not likely, but it's a possibility. Any virus of any kind can change its virulence as the epidemic progresses. Now, it could also become less virulent. That's the other possibility.
Back in Calgary, Marg, Pollon, the modern-day Noah, is starting to identify with another biblical giant commanded by God to construct a wall of protection around the city. And as she continues to pound the pavement, spreading the message of emergency preparedness, she too wants the church to build a wall of protection around their communities.
I tell everybody that it's Nehemiah's plan that I'm following, that Nehemiah mobilized everybody to work on their own piece of the wall, and this is what this structure is. If every church would take responsibility for their own piece of the community, we'll have an easy job, that there's not a big thing for anybody, and we can do it.
And she doesn't plan to end her mission anytime soon, as she continues to get churches together to fight this virus. For further information and to see more of our exclusive interviews, go to 100huntley.com.